Hey everybody, it's Katie. I'm doing a little what I'll call pre-labor diary. I did this with at the end of my pregnancy with Alice as well, and just as a way to kind of capture this moment in time. You know, it's like a limbo phase. We're just waiting on baby. But I think it's such a special time. I actually kind of love it. Of course, it's not like the most physically comfortable time, and it gets really annoying when people keep asking you if you've had the baby yet and that kind of stuff. But just for myself, I feel like, I don't know, it's just so relaxed and it's just so focused on our little family and on me and Mike as a couple, and that just feels really good. It feels like we're just totally on the same wavelength, and there's no rush. It doesn't feel like normal life. It feels like slower and more like we're just more conscious of everything. So I really, really like it. We've just been having, nights. Basically our calendar is pretty clear, except for Mike going to work and Alice going to school and stuff, trying to keep some semblance of a routine. But, anything kind of special is yet to happen, really. Like, we don't have plans made. So every night we're just trying to just take time for ourselves, take time together, just spend really quality time with Alice, and that's all really nice stuff. Mike and Alice are home, so I'm gonna go hang out with them and finish this later. Alright guys, picking up where we left off. I don't know if I've already said this, but today I am 38 weeks and 3 days by some people's count, and 37 weeks and 5 days by my count. So whatever. To talk about some of the physical stuff. So since last Tuesday, I have been losing bits of mucus plug almost every day. I'm really surprised that I haven't had any bleeding or anything yet. Like, every time I see it, I'm just expecting there to be something more, but so far not. Both of my midwives have just said they just can't see how this baby's head could get any lower than it is without coming out. And I think I mentioned in my last pregnancy vlog, I did ask my midwife to check me after I had checked myself, checked my cervix. And as of last Tuesday, so a week ago, I was 3 centimeters and super thin and super soft. And when I walked into my appointment with my nurse midwife today, she was shocked to see me. She said she thought for sure I would have already had the baby. I saw my home birth midwife on Sunday. We had to push back the appointment by a couple of days because she had a crazy couple of other births. So I finally saw her on Sunday, and she said the same thing, that she really had expected to hear from me in the past week. So I don't know what I'm holding out for here, but I think it will be soon. When I saw my home birth midwife, she was a little bit concerned that the baby, she thought the baby's size felt better, that the baby had gained weight, but that my fluid level was pretty low, and she recommended getting an ultrasound. So I wanted to hold out to my nurse midwife's appointment today to see if she agreed, because she has been the one who's always written the orders for ultrasounds, and that way I know it's covered by our insurance and stuff. However, the good news is that by today's appointment, she thought my fluid level was fine, and she agreed that the baby has grown, this is all really good. My fundal height measurement wasn't quite as off as it has been for most of the second half of the pregnancy. I was pretty stressed out going in, and I think really what made the change is that, well, first of all, I've been eating a lot of protein. That's supposed to help the baby kind of bulk up and gain weight, so I've been doing that for several weeks now. I've been drinking a lot more water, partially to try to boost my fluid a little bit. Sometimes that can make a difference, not usually a huge difference, but I've also just been feeling like I wanted to drink more water. So just those two things. And also my home birth midwife suggested on Sunday that I really should be taking it easy. I should be doing less exercise and less getting overheated and stuff, and just put my feet up more and relax. That's the first time that's ever been suggested to me in any pregnancy, but I have taken it to heart as much as I could. Mike was off work yesterday. It was a long weekend, and we just had a super relaxing time, and every time I felt like I needed to take a nap, he would take Alice to the playground, and I opted out of the walks that we normally take as a family on free days. I still did a little walk each day, but just very slow, and only if I felt up to it. So I think that's made a difference too, and that is what I'm going to try to stick with. It's harder, of course, when I'm home with Alice by myself during the week, but I'm going to try to stick with that as much as possible, because it really does make a difference for me and I guess for the baby, obviously. So I would say mentally I'm there. Like I'm ready for this baby to come at any time. Last night I had a bunch of Braxton Hicks contractions, just more frequent and stuff than they have been. And I just, you know, my gut feeling was like, fine, that's fine. Like this is it, let's go, you know? I'd say about 2 weeks ago, I sort of had like a mental shift where I stopped trying to accomplish things on my to-do list. And I just, I don't know, I just shut it off. And the real big priorities were taken care of. And of course there are like other things that I'd like to do, or I'd like to have the time to do, or find the energy or whatever. But I've just been treating them as like a bonus. Like anything extra I get done before the baby comes is just like icing on the cake. But if it doesn't get done, I'm not going to feel bad about it. I'm going to, you know, it's not a big deal. We're just going to deal with it. So just really kind of like giving myself a pass, I guess. And that feels really good. I haven't had the kind of crazy nesting at the very end that I think I had with Alice. I remember being in labor with Alice and like making cookies, because I had to make cookies to take to the nurses. Like that was one of the things in my brain that I had to do before the baby could be born. And I just don't really have anything like that this time. You know, when things start picking up, of course midwives think that that this birth will be faster. Second babies usually do come faster, and already because the baby's so low and everything else, that my body just seems ready, that they think it'll be a pretty fast labor. That sounds great. Not too fast. I don't want anything like crazy, but you know, I just don't have any of those expectations of myself for things that I'm going to try to accomplish when it's go time. Like when the action's happening, I'm just going to focus on what that is, and just the things I need to do, like filling the pool and calling the people I need to call, and that's really it. So I think that's just about everything in terms of like my thoughts and feelings at this point. I feel like I'm just in a really good headspace, and I'm just trying to give the baby the message that, you know, that we're ready to meet. I will try to do little updates as the action starts happening. Inevitably, it has to, right? It's a one-way street that we're on. So at some point, you know, it's gonna happen. I'm just feeling so excited, and I guess for the meantime, just trying to get my rest before I'm going to be up with the newborn. Thank you guys for all of your excitement and words of encouragement and everything. It just feels great. And I guess I'll talk to you soon, one way or another.